Hello everyone, welcome to QAxon. So in this video, you will learn about myopathies and muscular dystrophy. Under this topic, I will first be discussing some general characteristics of myopathies and muscular dystrophy, followed by a more detailed discussion on muscular dystrophy, particularly Duchenne muscular dystrophy. So here we go. So what are myopathies? Myopathy is a general term referring to any disease that affects the skeletal muscles. Now, these are very rare disorders and are accompanied by structural or functional changes in the muscle, leading to muscle weakness. Some of the myopathies are genetic and can therefore be passed on from parents to children. Now, the primary symptom in most myopathies is muscle weakness without any sensory symptoms. So, myopathy is typically present as symmetrical proximal muscle weakness involving mainly the pelvic girdle muscles or the shoulder girdle muscles. Also, the reflexes are preserved. Now, the type of weakness in most myopathies is persistent weakness. There are very few myopathies with intermittent weakness similar to that of myasthenia gravis, and these include periodic paralysis, some of the metabolic myopathies, and mitochondrial myopathies. Now, myasthenia gravis is more of a neuromuscular disorder. It is not categorized as a myopathy. So most myopathies are characterized by persistent muscle weakness. Now the most common pattern of muscle weakness in myopathies is symmetric weakness, affecting predominantly the proximal muscles of the legs and arms, what we call as the limb girdle distribution. The distal muscles are usually involved to a much lesser extent. The neck muscles could be frequently affected, but facial muscles are rarely affected. Let's now specifically talk about muscular dystrophies. So, muscular dystrophy is a group of diseases that causes progressive muscle weakness and loss of muscle mass. In this condition, there are certain mutations in some genes which interfere with the production of proteins needed to form healthy muscle. So this is a group of genetic diseases characterized by degeneration and a loss of muscle fibers and therefore progressive muscle weakness. From a biochemical perspective, an elevated creatine kinase is the hallmark. Now there are many kinds of muscular dystrophy. The more common varieties are seen in children. So the symptoms begin in childhood, mostly in boys. The most common muscular dystrophy in children is Duchenne muscular dystrophy. And certain other types may not surface until adulthood. And in adults, the most common dystrophies are myotonic dystrophy and the limb girdle dystrophies. Now let's try and understand the pathogenesis of muscular dystrophy. In order to understand this, let us take the example of a rubber band. What happens if you repeatedly stretch a rubber band? Naturally, it will lose its elasticity. It might even break. Now, the same thing should be happening in our skeletal muscles because we are repeatedly contracting our muscles, but our muscles do not undergo this kind of damage. And this is because we have some structural proteins which preserve the structure of the muscle despite repeated contraction and relaxation. But what would happen if these structural proteins were abnormal, if there was some alteration of these structural proteins? This can happen if there are some gene mutations, and this is exactly the case in muscular dystrophy. So in muscular dystrophy, there are some genetic mutations which lead to faulty structural proteins. The protein most commonly affected is the dystrophin glycoprotein complex. So what happens when this protein is faulty is that With repeated contraction over a period of time, there is structural damage to the muscle. There are what are called as stress fractures of the sarcolemma. So now you have small break points in the sarcolemma. Now, through these breaks, calcium ions can enter. Now, once calcium ions enter, they will activate some proteolytic enzymes which can cause autolysis of the sarcoplasm, what we call as myonecrosis. So, in this process, the individual is destroying their own muscle fibers. So, with progressive autolysis, they start losing more and more of their own muscle mass, and that is what leads to weakness. Now, in Duchenne and Becker muscular dystrophies, which are more common, the defective protein is dystrophin.